Femoral triangle, femoral canal, and femoral sheath. Femoral triangle is also called Scarpus triangle. In anatomical region, it is located in the upper third of the thigh. And the femoral triangle is a triangular depression which is located below the inguinal ligament. It is seen when the thigh is flexed, abducted, and laterally boundaries rotated. Of the femoral triangle. Femoral triangle, it is bounded medially by the medial border of sartorius muscle and laterally by the medial border of adductor longus muscle. Base is formed by the inguinal ligament. Apex is formed by the crossing of both the boundaries, medial boundaries of the sartorius muscle and the adductor longus muscle. Apex of the femoral triangle is continue as a adductor canal. Roof of the femoral triangle, it is formed by the skin, superficial fascia, deep fascia. Superficial fascia contains the superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, and branches of ilioinguinal nerve, superficial branches of femoral artery with the accompanying veins, and the upper part of the great saphenous vein. Deep fascia includes the cribriform fascia covering the saphenous opening. Floor of the femoral triangle is formed by the adductor longus and pectineus medial side, and lateral side it is formed by the psoas major and iliacus muscle. Now the contents of the femoral triangle. Femoral artery and its branches. Femoral artery, it traverses in the triangle from base behind the inguinal ligament at the midinguinal point to the apex. In triangle, it gives off 6 branches, 3 superficial and 3 deep branches. So here you can see the contents of the femoral triangle. From medial to lateral side, there is femoral vein, femoral artery, then femoral nerve. Femoral artery giving off its 6 branches, 3 deep and 3 superficial branches. Femoral nerve also giving its branches. This is the femoral triangle. You can see here that medial border of sartorius and medial border of adductor longus, and base is formed by the inguinal ligament, and the contents of femoral triangle are seen. Second content is the femoral vein and its tributaries. Femoral vein which accompanies femoral artery means they have same names as of the femoral artery. Branches have same names as that of the femoral artery. And the vein is medial to the artery at the base of the triangle but posteromedial to the artery at the apex. Femoral vein, it receives the great saphenous vein, circumflex veins, and veins which correspond to the branch of the femoral artery. Femoral sheath, it encloses upper 4 cm of the femoral vessel and 4 nerves. Femoral nerve lies lateral to the femoral artery outside the femoral sheath. Femoral sheath does not include the femoral nerve in the groove between the iliacus and the psoas major. Nerve to pectineus is also the branch of the femoral nerve, and third is the genitofemoral nerve. Nerve to pectineus, it arises from the femoral nerve just above the inguinal ligament. It passes behind the femoral sheath to reach the anterior surface of the pectineus muscle. It supplies the pectineus muscle. And the femoral branch of the genitofemoral nerve, it accompanies or occupies the lateral compartment of the femoral sheath along with the femoral artery. It supplies most of the skin over the femoral triangle. Genitofemoral nerve supplies the skin of the femoral triangle. The lateral cutaneous nerve of thigh, it crosses lateral angle of the triangle and then it runs lateral side of the thigh. It then ends by dividing into anterior and posterior branches. Lateral cutaneous nerve of thigh, it gives 2 branches, anterior and posterior, by running the lateral side of the thigh, and that supply the anterolateral aspect of the front of thigh and lateral aspect of gluteal region. Then the deep inguinal lymph nodes, they lie deep to the deep fascia and lie medial to the upper part of femoral vein, and they receive the lymph from the superficial inguinal lymph nodes. From the glans penis or clitoris, glans penis in males and clitoris in female, and deep lymphatics of the lower limb.